Hello and welcome to Pregnancy Info. Today we are going to discuss 18 causes of abdominal pain during pregnancy. Abdominal pain during pregnancy is common during pregnancy. Learn the causes of abdominal pain in pregnancy and find out whether your symptoms are normal or require immediate attention from your healthcare provider. Some abdominal pain during pregnancy is normal. After all, your organs are constantly shifting, your uterus is expanding, and your ligaments are stretching, all of which can cause benign aches and pains. On rare occasions, through abdominal pain can signal something serious. Consult our guide to learn more about the causes of upper and lower abdominal pain during pregnancy and find out when to call the doctor. Harmless cause of abdominal pain during pregnancy. From constipation to round ligament pain, here are some common culprits that cause harmless abdominal discomfort during pregnancy. Keep in mind that if the pain you are experiencing continues or if you have worrisome symptoms such as bleeding or strong cramping, you should check in your OB/GYN right away. First cause is your growing uterus. As your uterus grows, it displaces your bowel, which can lead to nausea, a sense of feeding full easily, or distension in your abdomen. Eat more frequent and smaller meals, exercise regularly, and get enough rest and empty your bladder often. Round ligament pain. Sometimes as the uterus enlarges, it stretches the round ligaments, two big ligaments that travel off the front of the uterus and down into the groin, and typically occurs on one side of your belly, though it can strike both. You may feel it as lower abdominal pain that radiates into the groin. It may be sharp and stabbing or dull or achy, and it usually lasts for just a few seconds. It can be triggered by any movement that causes these ligaments to stretch, like coughing, sneezing, laughing, or getting up suddenly. Round ligament pain usually resolves on its own, but if you are extremely uncomfortable, ask your OB/GYN if you can take acetaminophen. Constipation and gas. Constipation and gas are often part of the pregnancy package. Unfortunately, progesterone, a hormone that increases during pregnancy, slows down your entire gastrointestinal tract, making foods travel more slowly through it. To combat constipation, drink plenty of water and eat fiber-rich foods. If that doesn't relieve the problem, your midwife or OB/GYN may recommend a stool softener or a fiber supplement. Braxton Hicks contractions. Braxton Hicks contractions aren't associated with dilation of the cervix. They are annoying but totally benign. The trick is differentiating these practice contractions from real premature labor. True contractions tend to get closer and closer together. Sometimes can carry on a conversation, watch television, or read. Then the contractions are probably not real labor. Dehydration can trigger Braxton Hicks contractions, so drink plenty of fluids. If the contractions persist or you are not sure whether they are Braxton Hicks or true contractions, call your OB/GYN. Serious causes of abdominal pain in pregnancy. For a smaller number of expecting parents, serious pregnancy complications can develop that require immediate attention from your OB/GYN. Some red flags to watch for include bleeding, severe pain, fever, and visual disturbances. Ectopic pregnancy. Ectopic or tubal pregnancies, in which the egg implants somewhere else other than the uterus, more often in the fallopian tube, occur in 1 of every 50 pregnancies according to the March of Dimes. If you have an ectopic pregnancy, you may experience intense pain and bleeding between your 6 and 10 weeks of pregnancy as the tubes becomes distended. Miscarriage. When women experience abdominal pain during early pregnancy, you always have to be concerned about miscarriage, says Dr. Duff, because the unfortunate fact is that 15 to 20% of pregnancies end in miscarriage. Symptoms of miscarriage include bleeding and cramping that can be rhythmic or resemble menstrual cramps. Preterm labor. If you experience regular contractions before you are 37-week pregnant and it's accompanied by persistent backache, you could be having preterm labor. Now isn't the time to wait it out. Call your OB/GYN right away. The contractions might come with leaking vaginal fluid or blood or a decrease in fetal movement. Placental abruption. Your placental provides oxygen and nutrients to your baby. It usually implants high on the uterine wall and doesn't detach until after your little one is born. In rare cases, 1 out of every 200 births, the placenta can separate from the uterine wall, a dangerous complication that most common in the third trimester. Your uterus may become rock hard, and you may also have dark red bleeding that doesn't have cloth. Preeclampsia. According to the Preeclampsia Foundation of America, preeclampsia and other hypertensive disorders occurs in 5 to 8% of all pregnancies. Preeclampsia can develop after 20 weeks and is characterized by high blood pressure and protein in the urine. Because high blood pressure constricts the vessels in the uterus that supply the fetus with oxygen and nutrients, the baby's growth may be slowed. Preeclampsia also increases the risk of placental abruption, in which the placenta separates from the uterine wall before delivery. Urinary tract infection or UTI. Up to 10% of expectant mom will get a urinary tract infection at some point during their pregnancy. Typical symptoms include a sudden urge to urinate, pain or burning with urination, and bloody urination. But some patients with the UTI also experience abdominal pain. The good news is that if the UTI is caught clearly, it should be easy to treat with antibiotics, and that's one reason why your OB/GYN tests your urine during every visit. Appendicitis. Appendicitis can be difficult to diagnose in pregnancy. As the uterus enlarges, the appendix pulls up and can get up near the belly button or liver. That atypical presentation gives us a curved ball, and the delayed diagnosis raises the risk of dying from appendicitis during pregnancy. You may feel it higher up when you are pregnant. Other symptoms include lack of appetite, nausea, and vomiting. Gallstones. Stones in the gallbladder are more common in women, especially if they are overweight over the age of 35 or have a history of stones. The pain from gallstones, also called cholecystitis, is severe and focused in the upper right quadrant of your abdomen. In some cases, the pain may also radiate around to your back and under the right shoulder blade. HELLP syndrome. HELLP syndrome is an acronym for its 3 main parts: hemolysis, elevated liver enzymes, and low platelets. It's a life-threatening complication of pregnancy. It's unclear what causes HELLP, but some women develop the condition after receiving a preeclampsia diagnosis. According to the Preeclampsia Foundation, of the 5 to 8% of women in the United States who develop preeclampsia, it's estimated that 50% will develop HELLP. Bowel obstruction, food allergies or sensitivities, peptic ulcer disease, a stomach virus. These are some other causes of abdominal pain during pregnancy. The question is that when to call a doctor. Call your doctor immediately if your pain is accompanied by any of the following: fever or chills, vaginal bleeding or spotting, vaginal discharge, repetitive contractions, nausea or vomiting, lightheadedness, pain or burning during or after urination. Whenever in doubt, you call your doctor to go in and seek treatment at your birthing center. It is always better to err on the side of caution, but you can use some foods to prohibit the pain during pregnancy. Probiotics, ginger, peppermint oil, cinnamon oil, digestive enzymes, psyllium, vitamin D. These are the products you can use to stop the abdominal pain or less pain during pregnancy. I hope I have explained all the maximum reasons and causes of abdominal pain during pregnancy. If you like our video and find it useful, then like it, share it, and also subscribe our channel. Thank you.